Okay, I've been working with different forms of hands-on body therapy for 50 years. And I've learned many different techniques and approaches, methods. And as time went on, the things that were most productive and most powerful were the osteopathic techniques, as well as my work with Rolfing, which is a connective tissue release and reorganization of the body. What brings me here is I was at a convention where they had many different kinds of healing and medicine, herbal medicine, and so on. And there was a group of 6 or 8 people who looked really happy. And they were presenting Art of Living. And they were teachers, and they were showing some of the breathing techniques. And I felt very attracted to that, where all the other practitioners were half dead and dying and very serious. I was very attracted to the Art of Living presentation. And slowly over the years, I started to talk to people and meet them, and I took the basic course. And I just feel at home in Art of Living. So my contact has grown and grown and grown. And I think that's why I'm here. And it seems that the work that I'm doing seems to fit in with what's happening here. It really demands a lot to train people who know either the one or the other. And to have a hospital or an office where you can offer both is a great idea. We live in a time where many of the healing arts that have served different civilizations for hundreds or thousands of years are being swept away by the greedy pharmaceutical industry. And they have a lot of resources to advertise and promote, and people tend to think more and more of these solutions if they're having a health problem. We find that these solutions often have negative side effects and often don't give a satisfying result. So I think it's definitely worthwhile to look into the integration. And there's very little money to promote these experiments or researches or promotions of these compared to the billions and billions of dollars spent on big pharma. And if someone is not doing well, who do they go to? They go to the doctor. And the doctor is trained to either give drugs or surgery. And generally not trained very well in terms of what's possible with the osteopathy. I'll give you an example. Many people have acid reflux. And so when they eat, all of a sudden the acid comes up and it burns. And it feels terrible. In medicine, this is not a major problem. But the way they approach it is typical of many other problems. So if you have acid reflux, you just take a little tablet. They're very cheap, and they're very readily available, and people can even buy them themselves in the pharmacy. You take a tablet against the acid, and that might make you feel less uncomfortable from the burning, but in the long run it's terrible, because if you don't have enough acid in your stomach because you've taken a tablet to neutralize it, You can't digest proteins. The only place we break down and digest proteins is in the stomach with these acids. So if a person is constantly taking these tablets, their digestion is off, and they can't digest the protein that they've eaten, and that sits in their stomach. The undigested protein sits in their stomach, and it rots. And many of you people do not eat meat, but if you take a piece of meat and you leave it out on the kitchen table, within a few hours it starts to smell terrible. It starts to rot. And that's basically what they have in their stomach, and their stomach and digestive system is trying to break that down and absorb it. So they're going to have poisoned themselves with the byproducts of undigested proteins, and they're going to have protein deficiency. This is a pretty heavy price to pay. Whereas with osteopathy, you can find out where is the position of the stomach. Oh, it's right there. It's pulled up by the tight esophagus, and it makes it difficult to breathe. It's one of the most common factors in terms of COPD, because people can't breathe. Why can't they breathe? They can't use their diaphragm. So the person with taking these anti-acid tablets, which are very cheap and not considered dangerous and not considered to ever have side effects, is ruining their health. So they might feel less discomfort, but the rest of their systems are just not working. So if a person finds and is lucky enough that the osteopath knows those techniques, it takes about 30 seconds to pull the stomach down, stretch the esophagus, and get the stomach to work properly. That's a difference between osteopathy and the usual medical approach to that kind of problem. The more I've studied osteopathy, the more I see that there are many approaches, many treatments from the medical, which create side effects, which don't cure the problem, where the problem can be cured by an osteopath, immediately or over a shorter period of time. So I'm very much in favor of alternative approaches to medicine, as long as they're safe and as long as they work. And Ayurveda and the osteopathy provide solutions like this to many problems. Because they're two great traditions, and each one has a lot to offer. If you get someone who's trained in both of them, then you'll get a much better result in terms of health and wellness. I know very little about Ayurvedic, but my impression is it has a lot to do with our body type and our diet. Osteopathy does not go into either of those. So it's a great addition to the osteopathy to be able to get that wisdom and that approach from the same practitioner or the same group of practitioners. Help people with respiratory problems. COPD is the third leading cause of death in the world. Basically, if we ask what is it, aside from a fancy name, it means the person can't breathe enough, either breathe in or breathe out. and this causes them problems. It may also contribute to heart disease, because if the lungs are not able to move properly, then the heart is going to be suffering from a lack of movement and probably a lack of space. Also, we know there are, I think, 2 or 3 Nobel Prize winners who postulated, and it's been more or less accepted, that when there's a lack of oxygen in the blood, there's a possibility of cancer, either in the system generally or in that part of the body where there's not movement. So if we look at the causes of death, we say, is it possible that lack of breathing is a contributing factor in heart disease and a contributing factor in cancer? And we know that it's the diagnosis of COPD is usually associated with a person losing 5 years off their life on the average. So it is a leading cause of death. So if we can improve the breathing, then perhaps we can improve the health and wellness, and perhaps we can avoid these diseases. So I've been working a lot with that, and I've been using basically osteopathic techniques. I've known Ayurveda very little over the last 4 or 5 years, where I've been to different Ayurvedic practitioners, Lokesh. Gave me some medicine, and I've also gotten oils for my skin that fit my body type. I really don't know very much about it.